discuss how to take history from patient in exam. First of all, you will introduce yourself, then ask the full name of the patient, then age and residence. In case of occupation, some patients may say to you that they are not doing something these days, but you will ask the patient before your illness what you was doing. And then admission, ask the date of admission and route of admission. For example, he was admitted through emergency or through OPD. It will show the severity of the disease. Then comes the most important part of the history, presenting complaint. Here I have given example like vomiting of blood from 5 days and abdominal pain from 2 days. Presenting complaint should be in patient's own words. It should not contain the medical terminology like vomiting of blood should be here instead of hematemesis. So, and also note that the presenting complaints should be at least 2. If you will have more presenting complaint, or you will try to create more presenting complaint, that it will become difficult to manage them, because you will take a detailed information from this presenting complaint. And note that the presenting complaint should be in chronological order. And after asking about the presenting complaint at this moment, ask from how many days, then this is a important word. Ask the patient, tell something more about your disease. If you will ask these words, the patient may give some important information about disease. For example, if the patient had vomiting of blood, he may say to you that I have some chronic liver disease and he developed jaundice, and then you will ask some information at this point and you will gather some information. And next, ask about diabetes and hypertension and past history of TB. Please note that at this moment you will just ask about these things. You will not take the detailed history of diabetes, hypertension and TB at this moment, because you have to focus again on the presenting complaint. For example, if the patient has vomiting of blood, then you will ask the onset and frequency, amount, color and its contents. Then you will try to make the differential diagnosis, because the patient has given you some clue that the patient had chronic liver disease. So it is the possibility that this patient had esophageal varices, which has blood this time. So you will not stay on these words. You will try to make the differential diagnosis of the hematemesis. And because you have to satisfy the examiner that you have the broader knowledge, try to rule out the causes of vomiting of blood, and you will ask the questions about the blood thinners, any hematological malignancy and acyclic disease and cirrhosis of liver. And one important word is I want to say that if the patient says that I have vomiting of blood, if blood is coming from some part of the body, then you will also ask the question, is there any history of blood from any other side other than from this area? So next you will also ask about the abdominal pain, ask the location, onset and character, intensity and intermittency and radiation of the pain. Now this is the time to ask about diabetes and hypertension in detail. You will ask the micro and macrovascular complications of the diabetes, and if the patient has hypertension, then you will also ask about the hypertension in detail. You will ask about the compliance of the drugs, and in systemic review you will quickly ask the questions, and we will start with general questions like fever, weight loss, appetite, lumps and sleeping pattern. Then start from head to toe, like from CNS, ask the patient, is there any history of headache, seizures, or any visual disturbances. Then comes the glands, like thyroid, ask about the heat and cold intolerance. At the same time, ask about polyuria and polydipsia. Then comes the cardiorespiratory system. Ask about, is there any history of shortness of breath and chest pain, or do you have cough? That is enough. Then move to the GIT tract. Ask about any swelling difficulties, abdominal pain, and ask about bowel habits. Then comes the genitourinary system. Ask incontinence of urine or dysuria. If the patient is female, it is necessary or examiner expects from you to ask about menstrual history, and if female is overage, then you will ask about the menopause. And then comes the musculoskeletal system, ask about rash and joint pains. And then comes the medication history. You will ask the patient about the medication being used before the development of illness, because there are some medications which could cause some illnesses. And you will also inquire about the Hakim and herbal medications, because most of the patients are using this type of medications. And now ask the patient which type of drugs currently he is using for this disease. You will inquire about his dose of the drugs and how many drugs, and you will also inquire about the compliance. At the same time, the examiner want to listen that you should ask the question about the complication, because complication of the drugs. For example, the drugs like anti-tuberculosis drugs have some side effects, and examiner wants to listen them. And then comes the family history. There are some diseases which run in family, like hereditary spherocytosis. So you should ask about family history. In personal history, I recommend you at this moment you should ask about the patient, he is married or not, instead of asking initially. And at this moment ask the patient how many children, all of them are healthy or alive, or if there is death of some children, you will inquire about the cause of the death. Inquire about the income of the patient, and next you will ask the patient that I want to ask some personal questions from you, which will remain between me and you and are for necessary for the diagnosis of your disease. You will ask the patient about the smoking, alcohol and extramarital relationships. In smoking, you will ask the patient how many cigarettes per day from how many years, and you will calculate the pack year and you will tell to the examiner. And if the patient is using alcohol, then you will ask the type of alcohol and its quantity, and you will ask the cage questionnaire. And then comes the travel history. There are some diseases which are associated with travel, like infectious diseases, and the patient may have diarrhea, or you will ask about if you are suspecting about HIV, and then comes the vaccination history. At the end, I want to tell you that while taking the history, you should be confident, and you should not repeat your questions while taking the history from patient. Like I have seen some residents ask the patient, do you have cough? And the patient says that I have cough. Okay, you have cough. So do not try to repeat your words, and try to make formulas which I will present in my next videos, and try to memorize them, and try to ask the questions in sequence. And it is necessary to listen the patient. Active listening is very important, and give some time to the patient to say something. As initially I already told you, ask the patient, tell something more about your disease. And this is all about the history taking.